Hello, and welcome back to our final session for this afternoon. Up now is a panel of your peers, and I'll go through the introductions here. And we're looking forward. They all have their own perspectives on COB Smart, and they have a wealth of experience. So this is your time to ask lots of great questions and find out like maybe the do's or don'ts. I was telling someone earlier, COB Smart, when you're talking to someone, it's like building a house. What would you do again, and what maybe you would do differently this time around? So these are folks that can help you. So I encourage you to listen, look for commonalities and strategies that can be applied to your own processes. And so with that, I'm going to go ahead and welcome Kip Howard from Evolent Health, Mitzi Carlton of Premera, Pam Masters from Highmark, and Jake Hartberger from Molina Healthcare. So, and our MC of this panel session will be CAQH's David Colin Margulies that will be facilitating. Thank you.
Thank you, Sheila. All right. Well, thank you all for being here. Understand that we are standing between you and the weekend and the end of this conference, so we'll definitely try to keep it interesting and entertaining for you as we wrap up. So I think, Sheila just introduced everybody. I was going to ask everybody to introduce themselves, but since we already did that, I'm just going to quickly ask everyone to share something really quick about themselves, and then we'll jump right into the questions for the panel. So as you heard, I am David Colon Margulies. I'm a senior account manager at CAQH, and I'm going to ask everyone to share one thing that they're looking forward to in the remainder of 2022. So for me, I'm going to be taking a trip later this year to visit a good family friend in Austin, a city that I've never been to. And I'm looking forward to enjoying some barbecue and checking things out there. So we'll pass things over to the panelists now, and you can go one at a time, starting with you.
Oh, let's see. What am I looking forward to the remainder of the year? My husband and I will be celebrating 20 years of marriage this November, and we haven't planned on a place to go yet. So.
Oh, wow.
So I've got a very short period of time
To figure it out. Yeah.
Something fun for us to do. So.
Thank you. Jake, next.
So I am picking up a new hobby this year, skiing. So I went and got my ski gear last weekend and hoping to get out in October, November, and try not to hurt myself too badly.
Not to steal Mitzi's, but trying to plan a family vacation the week between Christmas and New Year's with 3 children and 5 grandchildren, of course the spouses too. So.
Oh, wow.
I plan on being at the Super Bowl. I know that's in February, so not this year, with my Dallas Cowboys are there. And we are going to win it all.
Not looking so good so far this year, but we'll hope for you.
Seriously, I just moved back to Texas from being up north for about 10 or 11 years, and that was right before the pandemic started in 2020. So I'm still just enjoying seeing family, people I haven't seen in a while. We're having our first family reunion since the pandemic started. It'll be in Arkansas. But yeah, just getting reacclimated to my family and friends that I haven't seen yet. Enjoying life.
Great. Well, thank you all for sharing a bit about yourselves. Now that we know a little bit about you, let's dive into some of the juicier COB related questions. So I think we're going to just start with a few questions that are general and go down the panel. And then we can zero in on a couple of topic areas and ask some individual questions of our panelists. So to begin, we'll start with the topic of automation. It was in the title for this session. And so I'm going to ask all of you to just share a bit about what the process has been like for, implementing varying levels of automation, where it's plugging into your process, and the value that you see it adding to your COB processes. So maybe we can start with Mitzi.
Yeah, in 2021, we deployed a bot to load our COB Smart records into our claims processing system. So that was pretty exciting. We have the entire file. Any overlaps are loaded in what we refer to as temporary loads. So it's an unknown record. There has to be investigation and primacy determined, but we're making sure that we're doing it at the right time when a claim shows up for that member and their family. So a lot of time savings.
Great. Jake, you want to go next?
Yeah, so obviously automation is a key to everything that we do in terms of improving cost savings and reducing some of our expenses that we incur. And we attempt to do that as much as we can pre-payment. Obviously, there's some components that reside within post-payment and likely always will to some extent. But we've, with CAQH and other data sources that we have, tried to build out a centralized application and repository that feeds into our claim processing system with overarching business rules, as much analytics that we can feed into that. And we partnered with our internal IT and an external vendor, iSpace, to build out a centralized source, whether it's state files, CAQH, additional vendors, something that we can prioritize and have business rules for all of those sources of COB and get analytics out of that to feed into our system. And the benefits of that are some of the timeliness, being able to get that in daily or real time, ad hoc as needed. And then on the post-pay side, we also have a recovery application that we worked with iSpace to build out, which is called ClaimShark. And those two applications, along with our claim processing system and our internal team, have synergies where what we would have to review post-pay manually is now not all of it is automated to flow into our recovery application, but the bulk of the standard procedures, things that have less dependency on covered services with Medicare or commercial, can now feed into that. So just trying to look at it from a spectrum of the continuum here and trying to automate it from front to the end.
And I apologize because we just started using the solution in July, sending our first file. So a lot of my responses are going to be, we're just new. But I'm looking forward to a lot of automation. I think the first step of automation that I have in my mind is to just be able to automate the file in identifying the records that we want to focus on first, and getting those to the team to load before we do any direct automation or robotic automation.
So I'm going to talk about two different things. One is automation of COB claim payments, because we have a lot of work to do there. And there is an initiative, I'm not sure if it will start in 2023, but it will very soon thereafter, if not in 2023, to increase what our COB auto-adjudicated rate is. The other thing that really rings true more here for while we're here is our COB, ingestment of COB files. So we have what's called a COB pool. The COB pool is a process where it prioritizes the information you're receiving by source. So, we get files from vendors, we get member calls that come in, we get claim referrals with COB information in them, we get state and federal files, CMS files that, like we've all talked about, not very good, but we prioritize those sources. We do that for the reason of what trumps what. So I'll tell you what our pool priority is. It's always vendor first, because that's the most accurate that we found. Number two would be an out area user, which is somebody in customer service, basically an employee that's taking phone calls or handling inquiries from claims that come in. And then the third position is always going to be a state file coming in or a CMS file, because those have the most unreliable and outdated information. And so what happens is, if we get a record in from CAQH or our other COB vendor, that segment is loaded and it's the highest priority. So if someone then receives a call in customer service and the member says, "Hey, just wanted you to know I got a new job starting February 1st and I'm going to have benefits there." Well, we're not going to, they may load they send it to enrollment, but they may load a segment starting February 1st. Remember, this coverage isn't in effect yet. Well, the member doesn't know when their coverage begins. It may begin after 30 days. It may begin after 60 days. If they start in the middle of the month, perhaps their benefits don't begin until the first of the very next month. So that information is not as reliable as what we have. But if they make a change to the existing record that we receive from the vendor, that night the system is going to run what we call the COB conversion file, and it will replace what that person did in enrollment based on that phone call and restore the file we received from the vendor, the record we received from the vendor. Now, sometimes that does cause problems, and when it does, we handle those individually. But the COB pool is not quite finished yet for the data validation that we're getting from CAQH. I think, Patty, correct me if I'm wrong, but our implementation finished about 90 days ago or so, and the COB pool should be ready pretty soon. So we're loading these records manually right now, but once the COB pool is up and running, then it should have an auto process where that is automatically ingested into our claim system.
Great. Yeah. Thank you for that, Kip. And so you sort of, all of you together, I think have triggered a train of thought in my mind, because you've obviously put a lot of thought into those processes, depending upon where you are in implementing automation, because there are a lot of nuances to how you effectively deploy automation and ensure that you avoid some of the pitfalls that can come with shifting, human beings working the data over to automated processes that are sort of accepting the data that's coming in from the system and using different dependencies to apply logic, right? So I think what we're going to do this time is start from Kip's side and then work our way back over here. And I just love to hear, since you have different experiences and perspectives, what are some of the things that, participating organizations should really think about before they go to implement automation, and some of the best practices for making sure that when you do flip those switches, you don't end up causing a lot of heartburn around how claims are getting processed.
I'm special. I have a microphone now. I would say know your data. Spend a lot of time understanding the data that you're sending out. Just as an example, when we first implemented with CAQH, we, for whatever reason, I don't know why, but we decided not to send delete files. And we found out pretty quickly that, we need to be sending delete files. That reduces our inventory. It reduces the number of records we're paying for, even though it's only, whatever per member per year. But just know your data. And I know this has been said before, but garbage in, garbage out. And that's just, it's so true when we talk about this process. So understand your data, know your data, listen to CAQH. On your monthly calls you have with your account reps, they're telling you where your deficiencies are. Listen to them. They know what they're talking about. And if you follow their directions, your data will get better.
Yeah, I echo exactly what you said, your data. I was not part of the implementation internally and pulling the data out of our systems. So when it got to the point where I became involved in the project, and started looking at it, I knew that the data wasn't right. The technical teams were assuming the information that was needed to be sent on the file, and it was not the right data. So, definitely get your data right before you send the file.
Yeah, echo those sentiments, at least from initial implementation with CAQH, and we don't have this perfected yet either, but, make sure that the data that you are sending is as accurate as possible. And then, once CAQH is implemented and you have these various sources of data, whether it's, the state, federal files or other vendor files, to Kip's point, making sure that you get familiarized with those data sets, perform, vast sampling of that, random sampling, so that you can have different accuracy rates by market, by data source, by coverage type, Medicare or commercial, so that you do have an informed basis for ranking those and setting those up in your system. And then, in terms of being able to process all of those, that's where having a centralized platform that feeds into your claim processing system is beneficial, because that allows you to intake multiple data sources, have those ranking systems in place, be able to get analytics from what's getting overturned so that you're maintaining those, and also being able to convert those into standard layouts. You're getting state files in an A34, or you're getting CAQH files, vendor files, they're all proprietary. And having a centralized platform allows you to standardize that and make, efficiency gains on it and apply the same business rules uniformly across those sources.
I would just parrot what everyone else has said.
Yeah.
Understanding the data, having a good, communications plan with your IT team that's helping implement, and also a good communication plan with your teams who are doing the work. What can they expect to see? One of the things we did when we set up to receive our first file is we decided to prioritize claims by, for every member with an overlap identified, we'd look at the claim spend over the last year, and we had a roll-up per member, but also per policy at the subscriber level. So it allowed us, we knew, and everyone will tell you is when you go live, you're going to have just an onslaught of data. We could at least prioritize those higher dollars and get those into the system and reviewed, and then start, understanding what we were seeing and dealing with.
I think great insights, and a lot of what you touched on when we talk about best practices for automation, I think kind of comes back to another topic that we want to cover today, which is about the implementation process, right? It's so crucial when you go to actually think about how you're going to set up all of these connections and workflows, that when you implement, you have the foresight to think through the potential, challenges that could come down the pike and try to implement in a way that has that kind of foresight in mind, and a future looking model, right? And so a couple questions, for the panel specifically. For those of you that were involved in the implementation process, what were some things that, if you could revisit your implementation, right, you would maybe make some different decisions? And then for those of you who are, sort of still coming through the implementation process, which, might just be Pam, I'm not sure. I think the rest of you have already done that. What are you thinking about as you're actively working towards those goals? So I think we can start with Mitzi again.
If I could go back, we would have a project manager assigned throughout the duration. I think we had a project manager about the first 30, 60 days, and then he was moved to another project. That's putting everything on your team lead, who's running a team of 30 plus people, who's trying to implement all of this. So I would say for those of you getting ready to implement, especially if you're at the manager, director level, really be talking to your frontline supervisors, understand the scope of their responsibilities in the team and give them those resources. Hindsight's always 20/20, but it would have made the process a lot smoother as far as communication plans, procedures, processes, all of it.
All right, Jake.
Yeah, so I wasn't part of the original COB Smart implementation and setting up our data extracts, but in seeing where we're at today and some of the challenges that we're still encountering, I think as we're having to do this and we have a project plan for next year to actually improve our data sets and do some remappings, improve some of the logic for how that's done. What we're working on is making sure that myself, my team from a business standpoint is reading through those technical guides, really becoming acclimated with what is the layout, how should all of those transactions be sent to CAQH to make sure that your data is being maintained and is current, and partnering with both your enrollment team, who may be most familiar with how is that member demographic data, how is the enrollment IDs changing, and partnering with them and your IT group so that everybody is on the same page with what's the expectation and workflow supposed to look like, which I think would really, we're hoping that will help improve where we're at, because we do see more missing records than we'd like to. But I think that collaboration and, upfront investment with reading through the technical guides, which are quite lengthy, but I think it will, have a return by doing so.
I think the other thing that I have is looking back, and what I might do different and ways to better do things. Just make sure that your team is set up. Your team that's going to be working the file already knows the primacy rules. Like, they're not learning that in conjunction with learning this new process. That, if you're creating a new team to do this, that they already have that COB knowledge.
So we had another vendor, not just a COB vendor, but they did all sorts of things for us, data mining, clinical auditing, but we had the contract directly with CAQH, but they were managing the data. We eventually realized, I guess it was early last year, that number one, they weren't doing what they should be doing. They weren't working missing records. They weren't giving us feedback on it. They weren't listening to CAQH during the meetings. They did a bad job of their own implementation. So we decided, as part of a Tesla program, a Tesla project actually, or initiative, that we were going, and this is in 2021, that we were going to start internalizing where it made sense. COB was one of those things. Data mining was another thing, clinical auditing, several areas like that. We wanted to pull the work back from vendors. So I'm only going to talk about COB, of course. So that's when we had to basically re-implement with CAQH, which probably started, Patty, in the fall of last year, something like that. And I have a PM that reports to me as well, Catherine Schofield. She would be here, but she's in New Zealand on sabbatical, her month-long sabbatical after 5 years. And she was looking at the technical guide. I'm wanting to get this done as soon as possible because we weren't getting the recoveries we needed, nor were we seeing the cost avoidance savings because this unnamed vendor wasn't doing a great job for us. So I wanted to get some money rolling in. Recovery is number one because there's time frames around those, but also to start watching the cost avoidance build up. And Catherine warned me, Kip, there's all these reports out there. We're going to have to do these reports. I'm like, okay, I understand. Let's just get the data flowing. Let's get, so we can get the low hanging fruit in, we can get recovery, show it to our program, show it to our plans, and then we can start tweaking the program, working these reports and doing the things that we should be doing. If I had it to do over again, I would have listened to Catherine a little bit closer and we would have spent a little bit more time on, figuring out the reports and the COB technical guide, that is the COB Bible. There should be one everywhere. If you understand that COB technical guide, your job will be a lot easier. So that's it.
Thank you all for that wisdom. So now I think I'm going to ask a couple of individual questions to each of our panelists. But before we get into it, I do want to just encourage, I know it's late in the day, and so we're getting close towards the end of the conference. If anyone does have questions for our panelists on the topics we're discussing, please feel free to raise your hand, and we're happy to include those questions throughout the conversation. Want to make sure we're engaging everyone. So I think on the topic of implementation, since we just sort of covered that, I've got a question for Pam, since you have sort of a more unique perspective on this being involved early on. And that's, what are some of the key things you think that a participating organization should have in place when they go to launch?
Know your team structure. I have a supervisor of the team. I've got a business analyst who really, manages the files. I have a lead claims processor. Right now she's handling the inquiries now that we're in the COB Smart portal. And then I have the claims processors. They're the ones that are really just, working the records, updating our primacy system, and then doing the adjustments to the claims. So have that in place, know what that structure is going to look like, know what your role is going to be in that. There's still a lot of questions because it is very new. And I feel like I've been in with COB Smart for like 6 years, and talking to Michelle. Yeah. So I'm the one that they do come to, with all of those questions.
Yeah, and I think one of the nuances you sort of touched on, and I think many of you have touched on it, is knowing your own process, but then not only understanding the technology that you're implementing, but how does your process map to that, right? And making sure the roles and responsibilities are clear, and that you've got your bases covered. Another thing that I think you touched on that I think is interesting is sort of the portal, right, in the workflow inquiry process. And so I've actually got a question for Jake now regarding the portal, and that is in terms of how the portal and your staff identify savings using the portal, and then what has that communication workflow been like going from, communicating with other payers outside of the portal to now having this sort of community through CAQH where you can engage not only other payers, but CAQH to help that flow of communication. Can you speak to that?
Yeah, and that's one of the great things with CAQH is that partnership with other payers and being able to reach out directly. If you didn't have that in place, you're using web portals or you're calling, the customer service line, and who knows how many times you're going to get bounced around with that. Establishing that direct line of communication with other payers where you can reach out, and the 5 days is the minimum, but most of the times you're getting responses back much quicker than that. And it's it's beneficial for both parties there, because you can help them if you're seeing anything anomalous with their data set or any trends that look anomalous or an outlier that may have occurred. You're seeing a spike in records, or starting to see a trend with some showing up that maybe should not be. Data changes a lot, and it may not be something that you're necessarily working on or deploying within your organization. But if there's a system upgrade, that data set that had been standardized and automated for years on end may, have some deficiencies now in the system. And so having that, being able to advise other parties that you're seeing that in their system, which are coming across on your overlaps, or being informed that yours has deficiencies in it, has really been a good feedback loop for us, a little bit more proactive than, maybe just viewing the dashboards themselves. So, we were discussing over lunch some of the enhancements that are coming down with the portal. We're really excited and looking forward to seeing those, especially that timeline of coverage for a member, across multiple payers. But the portal, I think, we leverage it, maybe not to the extent that it could be. So we're going to look to partner with CAQH, get a refresher course now that we have some new team members on there, and make sure, that we're leveraging that for everything that it can be. But even to the extent that, you're doing one-off verifications with another payer, or being advised of something that's cropping up in your data that needs to be remediated, it's a really valuable tool, and helps you build those relationships with the other plans.
Well, thank you for the kind words. I'm going to shift the topics a bit now to data validation. Each one of you, I think, has had a somewhat different experience either evaluating or implementing data validation. And so I think my first question is going to be for Mitzi, which is, around what has your experience been like evaluating data validation, and what are some of the things you've thought about when assessing the potential ROI or value add, when thinking about socializing it with leadership, understanding that's something that you're considering?
Our missing records report is something we're working on quite a bit. And that's one thing we want to get in line with our IT department before moving forward with the data validation. A lot of it is looking at what our impacts still to this day, right? Even though we have COB Smart, there's still those impacts to customer service, our providers, how claims are paying, the recoveries, all of those pieces. How does it come together, and how can we improve that? We still have a bit of work to do to socialize that. We've had a lot of restructuring. We have a new EVP, and I think everybody's familiar when we have restructuring and reorganizations. You kind of start from square one again, because now the data you had previously is 6 months old, 12 months old, and you've got to review it again. So it's just staying on top of your data, something that's been touched on already, understanding what's happening, and have that ready to socialize.
Yeah, thanks. And so then I think I'm going to pass it over next to Kip to sort of ask you to talk a little bit about your experience with the data sort of before and after implementing data validation. And if you have any advice for those that are evaluating it, what are the kinds of things to be thinking about?
Yeah, so we have been up and running with COB Smart since probably the spring. And since then, we've been trying to catch up for not doing some of the things in implementation, which we should have done, like I talked about, the missing records report, the U004, the primacy undetermined. I mean, it just goes on and on and on. We have only been on data validation for a few months. We have seen, I track cost avoidance savings by client, and we have definitely seen increase in cost avoidance. I think that's because the records that were coming in, we're getting better term dates, we're getting better effective dates because of the 270, 271 process. Where our COB overpayment recovery work is going down a little bit because we're catching more of it on the front end, which is the entire, reason why we do this, right? But yeah, that's what I would say.
Thanks. And then I'm turning it over to Jake and sort of ask you a similar question. What has your data looked like and your experience been like pre and post data validation?
Yeah, pre-data validation implementation, we saw, the data was sporadic, to say the least, and not at a point that, I felt comfortable automating any portion of that into our system. So prior to data validation, we were loading that into our databases, bumping that up against our incurred claims and paid claims data to see, you know, who are utilizing members, start prioritizing that based off of their medical spend within that time frame. And, you know, you're getting to a fraction of what's out there. And so we were yielding, you know, minimal ROI on it without data validation, just because it wasn't at scale. You know, the other vendors and sources that you're getting, you know, diluted those savings. So once data validation was in place, that allowed us to move CAQH up to our primary first source of data. We actually prefer, you know, that over even user updates, because user updates have a timeliness to them, right? You're getting CAQH weekly, and if you're using the portal, you're getting it in real time. So we were able to move that up for all of our implemented markets. We have about 80% of them live now, the remainder to go live in the next quarter. And, you know, the data quality, I think it was the individual presenting from UPMC, showed it, you know, an 85%, 15% split on which are usable payer data that they can automate. In our experience, we did random sampling across all the payers in all of our markets, and it was all of a 95+% threshold that, you know, is what we established as a usable, automatable data set. So drastic improvements, and since that's been implemented, our ROI on it is you know, spectacular.
That's great to hear. When I think we think about data validation in the COB Smart program, it's important to remember that COB Smart launched before we had data validation. And so there's been a process of plans and participating organizations coming on board and making decisions about implementing it and joining that program. You know, Pam, I'd be interested to hear what your experience has been like, understanding that you're still sort of at the beginning of the process, but coming on board from day one with data validation, it's a differentiated experience. So can you speak a little bit to what that's been like?
Yeah, so, you know, when you think about it, you know, like it was mentioned before, data validation before COB Smart was a telephone call to the other plan, you know, and then it may be right data, right, depending on what team you get whenever you call in. You know, is the group ASO, you know, like, do they use COB? So our team was very excited to know that they were getting the access to the COB Smart portal, you know, and processing claims, and, you know, they don't have to make those telephone calls. They don't have to, you know, wait on a call for 5 minutes or longer sometimes to get that information. So I think, you know, this validation is just exciting. It's allowing our claims to be processed, you know, quicker. You know, Kip alluded to a little bit of that earlier. You know, they process a lot sooner. We don't have to wait for a response back from a member. So.
That's good.
Yeah.
Okay. I'm going to shift once more to another topic, specifically this time for Kip and Jake. And this is related to some nuances around lines of business. So I want to ask you guys about sort of the nuances of COB in the Medicaid space. And generally, what has that experience been like managing COB through COB Smart for your Medicaid members?
Yeah, we're a little bit Medicaid heavy. We used to be, certainly. We're moving in a little bit different of a direction now, but we have several Medicaid MCOs that we represent. The number one question you have to ask your MCO or your Medicaid plan is, you know, do you have to obtain your recovery from the TPL through reclamation, or can you do a provider offset? That's a very, very important question, and I know a lot of plans have answered that question incorrectly, implemented with one vendor and realized, oh wait, we have to go to a different vendor. So what that means is, if it is a Medicaid plan where you must do reclamation from the TPL, you cannot do a provider offset. You cannot send a letter to the provider that says you owe me this money due to COB. You have to go to the other carrier, the Uniteds, the Molinas, the Highmarks, the Premeras, and get your money from them. Well, I don't know any insurance carrier that actually does that directly. Usually that is something you contract out. So we do use an unnamed vendor to do that. And if it is a non-Medicaid plan, or if it is a Medicaid plan where we can go to the provider, then we do that. But some of the nuances are when we get files in, if it's a Medicaid plan, they can have another Medicaid coverage. As an example, we have a plan in Arkansas, and we constantly get records in that say they have Medicaid of Texas as well. Well, do we load that segment? I mean, if we do, it's going to stop every claim, but how often are they going to Texas? So we typically aren't going to pay that Texas claim because it wasn't incurred in Arkansas. So we make a decision not to load that segment. But that's something that's very popular that you see. If the member lives in a border town, sometimes they're going to go to 2 different states and be covered by 2 different Medicaid plans, but it really doesn't help them. I mean, it doesn't help us that much. What would another nuance? We all know with Medicaid plans, the members go in and out of their other coverages. The one thing about Medicaid that's so easy is it's the payer of last resort. It's actually the best opportunity you'll have for COB coverage, for other COB coverage. But they're going in and out, and to keep track of that data and to understand that, wow, we've got 3 different segments for this person set for 3 months here, 5 months here, 6 months here with different payers. It can get a little, mind numbing in a way. But yeah, Medicaid's a little different, but first question out of your mouth to your plan should be, what is the law? Is it a regulation? Because sometimes it's a regulation where you can't go to the provider. Other times you can in that state. There's no regulation that bars you. However, when we talk about Medicaid plans and the Medicaid provider network, these are very narrow networks. These doctors really don't want to be in these networks. And so a lot of plans will take the position we don't want to put the provider in a situation of having to bill the other carrier because they're already getting small dollars, and this creates a ton of provider abrasion. You also look at Medicaid plans, and there's a longer look back period. So if you're trying to recover something that's over a year, or do recover it over a year, I mean, you're not going to, from the provider, you're not going to allow that provider enough time to go to the primary carrier to get paid, which again creates more provider abrasion. So yeah, we have parameters set up with our plans where we do go to the providers, and to tell us, okay, what if a provider complains because it's over a year, they can't get paid from the primary carrier? Do you want us to just default that and pay it back? Most of them do because they don't want to harm their member. But yeah, those are the things I would say that you should look for when you're dealing with the Medicaid plan.
Jake, additional thoughts on that?
Yeah, maybe a bit of a different perspective, just in terms of if you're evaluating, CAQH as a solution, and you may be thinking about how do you pitch that to your senior leadership team to get, initial investment. I came from the vendor side and, focused on COB, but then moving over to the payer side and on Medicaid, I didn't realize, what proportion of total savings are attributable to COB. A lot of, your different concepts within payment integrity, DRG, medical chart review, et cetera, they get a lot of attention, and, they're more complex maybe in terms of identifying it and making sure that it's accurate before pursuing that. But COB is 70+% in our Medicaid book of business, and we administer 4.5 million members at Molina across 22 health plans, and it's grown exponentially. So if you're looking for areas to squeeze out, some more dollars, it is ripe with opportunity. So just that's one perspective. But then along with it, to Kip's point, it's payer of last resort, which makes it sound simple, which it is in terms of applying, rules, right? Not like a commercial plan, but it is also high risk, right? You are not dealing with a group health plan, an employer, where you mess something up with them, sure, it can impact that one, but you got all of these other contracts, that are still at play. With Medicaid, if you are abrasive to your members, you're abrasive to the provider community. That is not just the member may not elect your health plan at next re-enrollment. If those providers are getting claims denied incorrectly, they're going to the state, right? You might lose that whole contract depending on, the amount of grievances you're getting, the appeals that you're receiving. So it is very important that you're selective with your vendors, right? One, because it's hard to get investment from your leadership team to begin with. And then once you're implemented with them, it's very hard to roll that back, and it can be very high risk if that goes, poorly.
Thank you both for such thoughtful answers. I've got one more question for the whole panel, and then I think what we'll do is just open things up to see if the folks attending have questions for the panel. And that is, can you talk to us a little bit about something that you have worked on this year in the COB realm, whether it be COB Smart related or not, that you're proud of that you've accomplished this year? And let's start with Mitzi.
Yeah, we've done a lot of work with automation, different scripting initiatives, working with our configuration teams, looking at how our claims are appended and reviewed through the system. So, gosh, in the last 2 months, we've probably rolled in 10 new scripts. We've eliminated a couple of pen codes and have tightened up the requirements on 3 other pen codes. So anyway, huge wins for our team. We have a very large COB unit. They have a lot of work to get through. And so it's really allowed them to get through claims more timely, which will make all of our partners out there in the audience very happy to see those claims get paid.
Yeah.
So that's been very exciting to have the collaboration with our IT department, getting our SMEs, and it's invigorating for our teams. I don't know about your teams, right? It's been a really tough 2.5 years that we've all been living through. So we're like, wow, IT's giving us attention. This is amazing. And, for them to participate in those kind of Gemba times with the IT team and then actually see a quick implementation, which quick and implementation don't always go together, right? So for them to see things put in the pipelines within 2 weeks, 30 days is really rewarding for the team. So that's been really exciting.
Thank you, Jake.
Yeah, it's ripe with areas that I'm proud of, but mostly with my team. Leanne and E are here. They've been pivotal to our building out our team, internalizing a lot of our operations that were previously done by either different internal departments or with various vendors, and working from home and being able to build a collaborative team is challenging, right? This is the first time I've met E in person in 2 years. So I'm just, proud of the work they're doing and how that is translating into savings. I joined in 2020 and we had 30% year over year savings growth, which obviously anybody would be happy with, but there's so much opportunity out there in the work that they're doing. This year, we're on track for another 18% year over year. So I think it's just a variety, of initiatives, but being able to execute is really critical.
Wow. All right, Pam.
So this year, there's been a lot of focus in our customer experience, customer service teams with like member provider abrasion around COB. You're all aware. The calls coming into those areas, if they're doing any voice analytics, coordination of benefits, other insurance are heavy hitters with those calls. So my team kind of gets the blame for it. When, a lot of times it's the questionnaires that the members aren't responding to, so their claims deny. So a lot of focus on, how do we try to eliminate and reduce those calls? So trying to figure out, knowing the partnership with COB Smart was coming up, what is a good way to try to eliminate and reduce some of those calls while getting the members to get the information to us. The questionnaires are obviously not working. Members are not opening their mail. I mean, they have to open their mail to be able to see it's a questionnaire. So, doing some other initiatives to try to get that information, and, pretty proud in having a partnership with that customer experience team and doing that.
All right. And Kip.
We do a lot of implementations. between us and Molina and Centene and Loomis, we kind of pass clients around to each other. But I would say we started the CAQH implementation toward the end of last year, and we pretty much have finished it this year, other than the COB pool part I spoke about earlier. That's a huge accomplishment. We also had an initiative around COB. We have what's called carrier codes in our system, which basically identify who that carrier is in our system. And we had carrier codes all over the place for every client. We would have so many carrier codes that were for the exact same carrier. So let's say Premera, for example. Maybe there was 10, 20 different carrier codes, but it all pointed back to Premera. We only need one. People would just go in and add a new carrier code because it was faster than looking up the one that we had in there for Premera. So we, Catherine, who could not be here today, she really helped a lot with standardizing carrier codes. We actually have one of our plans have their own carrier code. And we're like, okay, how are we going to do this? Because we wanted to have one carrier code across all plans. And we wound up having to build a crosswalk for them. But it was a huge undertaking, and it cleaned up our provider information and data that's in our system. And then you had also kind of talked previously about what are you going to do for next year? And I know the other folks didn't address that, but I will tell you this because I think it's important, and I've wanted to do this for a while. One of the first things I did when I got to Evolent, I'm asking, okay, do we have a responsible reporting entity number? Like, how are we contacting CMS? How are we getting information from CMS on traditional Medicare? Of course, we get Part C from our vendors, but we don't get Part A and Part B. So one of my goals for next year is for us as a company, Evolent as a company, to reach out to CMS and enter into a data share agreement so that we have an easier time contacting CMS to get information versus what we have to do today.
All right. Well, thank you very much to all four of you. I think at this time we can open things up to questions from the audience. So does anyone have any questions they'd like to ask our panelists? Oh, okay. We got our first question over here.
Actually, I have a couple questions, if that's okay.
I think that's okay.
So, Jake, you talked about the portal a little bit. As a new plan going live with implementation, one of the kind of worries in the back of my head is that the portal's great. It provides that connection, plan to plan, but what has been the experience for a new plan coming onto the portal, right? It's new data going out to all of these plans that have a level of maturity on the system. And am I going to have an influx of questions coming to me that I need to respond to within that 5 days because my data is now new and now you've got a lot of questions about what I'm sending you?
Yeah, so you certainly want to make sure that you have designated staff. I wouldn't say it has to be a full-time FTE, right? But make sure somebody's monitoring that. And I don't think any payer participating in the program is expecting others to be 100% correct, especially if it's a new payer entering into the program. And if you are seeing that, obviously you're going to be seeing trends, and you can work with your CAQH account management to see, okay, well, what are we seeing, in our database that might be prompting that? And if there is something that's, pervasive or recurring that you're going to have to invest to remediate, CAQH, and they've had to do this for us, can communicate to that other health plan, at least their management team, make sure that they're aware, hey, we did identify an issue with XYZ. They're working on fixing it. Be cautious with it for the time being. Don't inundate them, while they're working through that.
Great, thank you. And thank you all of you for that in advance. I've heard across a number of the presentations today, the talk about, I think UPMC used green. I think Mutual of Ohio talked about that you have your 4 plans that you that you trust. So I'd be interested to understand, how did you get to those for, or how did you get to those trust plans? And did that have anything to do with plans that are validation to validation? So is there like a higher level of comfort with the data that's coming across from two plans that are now validated data? Is that a good assessment, or is there something else we should be looking for?
I think anyone who wants
All
to
right.
answer, yeah.
I'll go first. Before we had data validation, we tried just sampling. And the way we sampled it is by market, right? So knowing, especially with some of the larger plans, and as much as they're trying to consolidate their legacy claim systems into one, we had higher concerns around, if they have a certain line of business or in their varying markets with different claim systems, that data is coming from a different source. We should be paying more attention to that and sampling it. So we sampled by state, by line of business, by plan. I think we did 150, 200 records initially, saw what trends we're seeing, and that helped form the basis of which we could trust. Before data validation, it was probably a subset where we were like, okay, that's good enough, we'll automate that. After data validation, like I said, we saw 100%, where it did come back at least with that 04, its validated primary coverage is determined, that we felt good moving forward with it, and that's maintained.
Last question. A number of you've talked about, I'll use your word, kit pool. You talked about having like a centralized, I think Pam or Mitzi may have even mentioned that you've got all these different COB type data sources coming into a centralized pool. Is that because of the different lines of business that you've got going in? Like, so your CMS files, your Medicaid files, that doesn't really have an impact on commercial business. Am I thinking about that incorrectly? Or as I'm rolling out a commercial implementation, we're starting with our commercial, do I need to worry about those other data files conflicting with the CAQH data that's commercial?
Yeah, so remember, if my plan is a commercial plan and what's coming back from CAQH is a Medicaid plan, well, we're not going to load that because we're going to be primary over them.
Right. I'm talking more about the data. Like you're saying, you're using these pools because you're getting data, COB data from all these resources. What I think I'm hearing you say is that overlap that I might be getting might be from CAQH, that's Medicaid, to IBC.
Yeah, remember that primacy rules happen as well. So,
Right.
if it's a situation where we're going to be primary, or our plan's going to be primary, well, then it's really not going to go through that pool process because we're not loading that segment.
Okay, so the pools really are kind of because of the different lines of business that you have in there.
It really applies to everything. But it's a priority of which source do we consider more reliable, and it has to follow that path.
That path.
But if a COB segment is not being loaded, then there is no pool.
There is no pool. And Jake, you said that you now go CAQH is your primary resource that you say is the most accurate.
That's been our experience. One, again, for the accuracy of the data, but also the frequency at which you're receiving those updates is trumping, certainly anything you're getting from the state, other vendors. The volume of those updates just make it worth, putting them first. And, you want to evaluate it yourself before jumping to that step. But based on our experience, that's made the most sense. And particularly where we see challenges with other data sets, it's not hard to procure new COB. It's very easy to identify somebody has other coverage, right? The hard part is maintaining that, getting timely term dates. Did something change that could, particularly in the commercial line of business, did a life event occur to change that? It's more the maintenance that I see the benefit of CAQH. Now, there's certainly incremental COB that they're providing for you, but the maintenance is the benefit of having that first and having those updates stick over, some reversions that may occur if you were using state files or, internal teams, coming through claims or something else, allowing that to flip-flop. We found it beneficial, put in place a hold on that, in conjunction with the precedent order.
And when you're talking about Medicaid, when we're implementing a Medicaid plan, they want their file to be primary. Hey, our file's best. We literally have to talk them down on that and say, let us show you why your file is not the best. And we will compare and give them true life examples to show them why their data is 2, 3, 4 months behind. We're getting real time data over here. And once we show them that, they're like, okay, yeah, you're right. You can put us down here.
And I think
Thank you.
what you need to understand too is prioritizing what is better data than something else. What we're dealing with right now is the calls coming into customer service from the members because we're starting to deny claims, and the members saying, I don't have any other insurance. Well, we have the enrollment information from the other coverage, so you do have other insurance. So if we would be automating, does an entry from a customer service rep entering the information into the primacy system, should that override what we get from the CAQH file? No.
Right. Yeah. Thank you all very much.
Great questions. Any other questions from the attendees? Okay, well, thank you guys so much for your time. Let's get a round of applause for the panelists. Really valuable insights, and thank you all for being here. I'll turn it back over to Sheila.